Welcome to selfdiscoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to another show of Your Health is Your Choice, right here from Self-Discovery Radio, self-discoverywisdom.com. I'm your host, Sarah Troy. My guest today is Larry Goldstein. We're going to be talking about fixing the broken health insurance industry. And we all know in America at the present moment, it seems to be like confetti scattered everywhere and not really serving the people. He says too many families, individuals, and businesses are getting financially destroyed by the high cost of quality health insurance. Since profits always seem to come before people's health to health insurance companies, we have a major problem. One of the great things that's been offered by this plan is free 24/7 telemedicine. He was having a pain and he thought it was muscular. And so he called the free telemedicine. The doctor didn't know how he looked or sounded, so he told him to go directly to the hospital. And in doing that, he was immediately wheeled into the operating room to receive a 4-heart stents, staying productive with his health and probably saved his life. His passion is for helping families and businesses get the quality and affordable healthcare that all humans deserve, with the ability to research and choose their own doctors. He's been a professional realtor for years. They were forced to go on the ACA when it came out, which they did not like as it was expensive and the quality care was not good. And he found this product. He was very skeptical at first. I didn't believe that it could be true, but it not only has proven to be true, but proven to save his life and be a godsend to many, many people. So welcome to the show, Larry.
Thank you, Sarah. Thanks for having me.
So you contact telemedicine. They said this doesn't sound right. I can't see you or hear you, but I want you
No,
to go.
it was on a video call.
Oh, it was a video call.
Yeah,
So
and he didn't like my look, he didn't like my color, and he didn't like where, because I just thought it was muscular, and he
mhm,
didn't like where I was pointing. And he says, for if you were smart, I'd get to the hospital.
mhm,
And I had two 90% blockages in what's called the widowmaker artery.
right.
So if I wasn't proactive with our health,
Hmm.
who knows? Okay. And that's the problem with health insurance nowadays because it's so expensive that
Yes.
even people who are buying it are afraid to use it
Hmm.
because their deductibles are so high.
Yes.
So it's about life. Without your health, nothing matters. And
Exactly. It doesn't matter how wealthy you are or how brilliant you are. If you don't have the health, then it doesn't matter. And how many people, I've got a pain, but I can't afford to go to
uh,
emergency. I can't afford to go to a doctor. Um, I'm just going to ignore it, or I'm going to do something else. And how many people do we lose every year that we don't even know about?
no, and that's the whole thing. And that's why, again, we're all entrepreneurs, so I never get upset at anyone for wanting to go out and make a living.
Right.
But when it comes down to your health, when they're making billions and billions of dollars and people are suffering, something's
Yes.
wrong.
Yeah.
And then one of the plans that we offer is run by a not-for-profit. So it's actually all about your health.
Hmm.
And the the premiums are way lower and the care is better. Because if you take away the bureaucracy and
Yes.
that they're designed to say no, that's the kicker. You're paying all this money with these high deductibles, and still their goal is to say no,
Hmm.
right? With this company, they don't get in the way of the doctor-patient relationship.
Mm.
So if a doctor says you need XYZ, that's what you're going to get. And that's a game changer. To me, that is
Ah, yeah.
that and the point that you don't have to go to the darn doctor that your insurance company tells you to go to. Or
Right. Right.
that's crazy. It's our health is our life. So I like to make my own destiny and be able to research the person that I'm going to trust with my life, right?
Exactly.
I want to get to know that. I'm going to make that my choice. And if I don't like someone, I want my choice to go to another doctor.
Yeah, and you want somebody that you feel is really hearing you, that's really invested in your health, and not just the next, which we
Right.
see so many with doctors. Oh, here's a pill, off you go,
Mhm.
and really without looking at what's the root cause, and you just feel that you're a number, you're not a person.
Exactly. And families are getting destroyed.
Yeah,
We're in a world where the
yes,
more
absolutely.
more the more children that you have, the more expensive it is.
Hmm.
And when you have a lot of children and one gets sick, it's hard to take care of that child because you have all the other children to worry about and they're getting sick. With the telehealth, first of all, you get the telehealth. So if one kid has a flu, get on the telehealth, get a prescription, get everyone healthy.
It,
But
it,
the
it
real
goes with
cool
the
thing
parents.
price wise
Yeah,
is again, this company wants you to have multiple children.
right.
Okay. It's a faith-based company, but
Hmm.
nobody's excluded.
Right.
So with the plan, if a husband and wife have one child or 12 children, they don't pay any extra money.
Wow,
Okay.
that's a
The
big one.
premiums are the same.
Yeah, that's a big one.
And that's huge. And the deductibles are not per person. They're for
Hmm.
the entire family.
Mm,
So if you get a deductible of $2,500, you're going to get where actually the coverage company is going to start paying rather than the insurance companies who their goal is for you to pay your premiums and never get to your deductibles and they never contribute a dime.
exactly. I mean, we know they're in it for money. We've been saying this for a long time, especially in Western medicine. It's always about the bottom dollar. The people that run the hospitals, it's always about the bottom dollar, not about patient care. And you were talking about children getting sick, but what we run into is parents getting sick, and they still have to look after their children, and they can't afford to go to a doctor because, it's do they have the money, or are they feeding their kids this month? And then they actually end up making their kids sick, and then it's the whole complete thing going out there. One shouldn't have to choose between rent, food, or medicine or doctor care. It shouldn't be. Other countries, like I'm in Canada, we have healthcare, right? Obviously, for anything extended, etc., there's a fee, but for general healthcare, to see a doctor, to get your medicines, to everything else, or x-rays, or anything else that you need, it's covered. And that's what our taxes are paying for. And so I don't understand in America, which is meant to be the richest country in the world, why you have so many poor people that can't afford medical health.
Well, obviously we're more free market here. But we have better doctors, we have better care, it's just people can't afford to go to them. And that's what having proper health coverage is being able to go to those doctors and being able to go to the doctor of your choice. Even if your doctor's across state lines, you can go to that doctor.
Hmm.
You know, this plan is good for any state in the country. So if you live in Minnesota and your doctor's in Illinois where you used to live and you want to go there, you don't have to worry about it. You go to that doctor.
Right.
Okay. And if
Yeah.
you're traveling, for us that like to travel, God forbid something happens
Hmm.
anywhere in the world, you're taken care of.
Wow.
Where in the
So not
world.
just the country, the whole world.
Hmm. Hmm.
As you said, this is a faith-based organization, and they run it as a nonprofit. Clearly, somewhere along the line, the founders ran into a problem with somebody having to pay a lot, or not getting the care, because that's how these type of things start. And when people actually come from the heart and the ethics of healthcare, uh, I can clearly see why they started this, because they've probably witnessed far too many people facing death because they couldn't afford health. And I really just don't think in this day and age that that should be a question.
Correct. I mean, I couldn't agree with you more. And again, it's not just going to see a doctor, it's going to see the doctor of your choice.
Right? Yes.
Or if you need a specialist and you know you need a specialist, you usually got to go to three, four different doctors to get this referral, that referral, this referral,
Mm,
and then you get sent to someone that you have no idea who they are. With
right.
this, if you know you need a specialist, you don't have to go through all that rigmarole. You go research your specialist, you go find that specialist and you go to that specialist.
Hmm.
And one of the beautiful things about it is doctors love when we introduce them to this plan
Hmm.
because in this country, insurance companies are notorious for slow paying the dickens out of you.
Yes,
Okay.
yes.
I mean, months and months and months, or
Hmm.
months just to get an approval. Okay.
Hmm.
Well, with a not for profit, they're built to pay. So
Mm.
doctors get paid in 2 weeks.
Wow.
Okay. Which they're not
Yeah.
used to.
No, gosh, no.
They're not used because people forget again, doctors, hospitals, I know they're there for our health, but they're still a business.
Yep,
They
they're
still
still a
gotta pay
business.
bills. They still
And
have to-
people think that doctors earn a great deal of money, and to certain industries they do. I think plumbers make more, than doctors. And what we don't realize is, all the paperwork. What we ran into a problem with in Canada is a shortage of doctors, and one of the problems was is the overhead. The actual premises of the surgery, the staff, and then all the paperwork that they had to do was kind of taking time away from patients. And they kind of couldn't afford that because, especially post COVID, all the rentals and everything else went up sky high. And so now it's kind of trying to bring doctors back, make things more affordable, make it easier for them to do all the paperwork and get behind the doctors. Because if we don't get behind the doctors, how can they give good care?
Correct. 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 I mean, you said it all, and that's the beauty of what we do.
Hmm.
We make sure that doctors get paid because that's what it's all about.
Yes.
If doctors aren't getting paid, doctors when they get older, they're just going to retire early, and they don't want to deal with the garbage.
Or
But
they
when
go into private practice where they're going to
or,
get paid more thing. And who can afford then the private practice?
or they go into a concierge service where only
Mm.
real rich people can afford them.
Exactly.
You know,
Exactly.
no,
Yeah.
when doctors are getting paid, and again, it's not just doctors getting paid quickly, it's not having to worry about an
Mm.
insurance company
Yes.
telling you how to treat your patient.
Hmm.
When you get some bored, oh wow, this surgery is expensive. Now put him on drugs. The doctor's like, the guy needs this surgery, and if the insurance company turns it down, there's nothing the doctor can do about it.
No, not without
Mm.
losing their license or facing jail time, which is
That's it.
ridiculous, and it needs to be completely shaken up. And I think what we have to do in all of these industries, health industry, mental health industry, all of it, we need to start looking at how are we investing in humanity, how are we investing in life, not capitalizing on death. And we've got pharmaceutical behind these big companies, the insurances. And it's like just push a drug, push a drug, push a drug, instead of a doctor actually having the time to be able to look at the patient, send them for investigation. What's the root cause? What's the problem? Instead of band-aiding it with drugs. But the pharmaceutical companies are pushing and pushing and pushing, and people end up being sick from the drug because it's the wrong drug for the problem.
Well, I'm glad you brought up mental health because I deal with people involved in that industry. And mental health, there's obviously no one wants to admit they have a mental health issue.
No,
And
we still got a
but
stupid stigma around it.
but right, but the bigger issue is um, if you get diagnosed with a mental health issue before you're covered,
Mm,
now that's a pre-existing condition. Now you're stuck. You're
right.
on state care forever. So the key to mental health is obviously diagnosing it early.
Yes.
And most people haven't gone to the doctor for it. So if they get the plan, then they get diagnosed. Now they're covered. And the telehealth that we also have free telehealth for mental health issues.
Hmm.
So no, we're all about taking care of mental health issues because that's something that is so neglected.
Absolutely.
It's a pride thing. It's a pride
Yes.
thing. But the last thing you want to do is finally decide to go to a doctor. You don't have coverage, and
Right.
now no one's ever going to cover you.
Yes, and there's also a great deal of stigma around people with mental health, and we've got to understand if the mental health, if the mental aspect of ourselves is at dis-ease, it creates disease in our body. And because our mental health puts a great deal of strain on the rest of your organs and the rest of your body. And so if we're not treating the whole of us, And like, what we see so much is sending you to a specialist for one little part of you instead of treating the whole patient holistically, looking at, the what are the mental aspects of it, what's causing the physical, what physical is causing the mental. Why are we not looking at the whole of a person? And again, that goes back to affordability. Can they afford to go see this specialist or have this x-ray or have this done or have that done while they're trying to investigate what the root cause is? Most people will be bankrupt by the time they get there.
Well, and again, mental health, obviously, the key is early diagnosis.
Mm-hmm.
And one of the beauties of this plan that I offer is that when people get the coverage, now they're signed on, they're covered. The first thing we allow them to do and want them to do is get a free checkup. Okay.
Mm-hmm.
The
Mm-hmm.
immediate, and we'll even pay for it early for your doctors. So we want you to check yourself out
Yeah.
immediately.
Yes.
Okay. That's the whole goal
Get
is
the assessment of where you're at.
get check.
Yeah.
And one beautiful thing is again, we have just the one plan that has different deductibles ranging from 2,500 to 10,000. But being a company that truly cares about your health, they give you incentives to stay healthy.
Mm,
Okay. If you have a gym membership, if you take Pilates classes, if you get massages, if you take supplements, anything that's proactive for your health,
mm-hmm.
you can actually submit those bills and get up to $150 a month off of your deductible.
Well, yeah.
So you can actually get a family deductible down to $700 if you're doing proactive health activities.
That
So
700s per year, right?
per
Not,
year for
all
the
right.
entire family. Yes, it's again, it's one of those, like I told you, this took me a while to bite because it's
Yes.
too good to be true. This is too
Uh-huh.
good to be true. I'm too old for this, man. What's the catch? And when I realized there isn't a catch,
Mm-hmm.
and we put it out to our people that we know through real estate, and some people got the plan, and it's like people are using it and they're really happy. I mean, again, and then when you see, I give an unfortunate situation, but a friend of mine who got on this plan through me, she got into a horrific car accident. Now, you don't believe a product's that good on paper until you see it in action.
Yeah.
And unfortunately, again, she's fine now. She's in rehab. She's doing great. But her car was accordioned. I mean, she was lucky to be alive.
Mm,
And she had to be airlifted to Phoenix. And not only is she airlifted, she was spent weeks in the hospital getting all the best doctors. Now, when she got home, she wanted to do her own research to pick her own rehab facility, which she was able to do,
mm-hmm.
and everything was taken care of. She had no worries whatsoever.
So all she could do is concentrate on getting well again and
Yeah,
not
well,
concentrate of like, how can I afford this? How can I do this? Or they want me to see a doctor over there that's miles away and that takes so much out of my body that's trying to recover.
mhm.
So yes, I mean, it is about the well-beingness of a person. Again, that is the physical trauma that can upset the mind. And so if the mind is at ease, that you can get the support you need and you're not worrying about that, then the body can heal faster.
Well, you couldn't have said it better. I mean, that's just, your mind is,
Yeah,
I mean, we have no idea how strong our mind is, right? They're
right.
constantly
Good
finding
or
out how,
bad.
right. Oh,
We've
no,
got to
exactly.
reprogram it sometimes.
Exactly. But no, you got to have that fear, fear's got to be gone. That God
Mm,
forbid something's wrong and I got to see a doctor. One, I can see the doctor of my choice. Secondly, it's not going to bankrupt us,
right.
because
Yeah.
people that have coverage are still afraid to go to the doctor because of the cost. You
Well,
know,
you've got people that have accidents and the ambulance comes and they're saying, no, 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 no. I can't afford the ambulance. I can't afford the ride to the hospital. I can't afford the hospital. And they'll, you know, completely, no, I don't want this, and go home probably with something very serious. And they know it, like, no, I'm just going to get bankrupt if I go. I don't have the money. What will happen to me if I can't pay for this?
right. And it goes to me, I take it to another level. It's like, you got families that are doing the right thing. They're paying, $1,500 a month for coverage for their family, even though not might not be great coverage. And now I get them something better that's $600 or $700 that's better.
Mm,
Forget the health for a second. Now they got $800 of disposable income to enjoy life.
mm-hmm.
To me,
To
That's a
buy
big
those
one.
supplements, to go to the gym, to go and do all those other
Right,
things,
right, right.
right?
But I mean, life is everything. You can't, when you're paying more than your mortgage payment for your health,
Yes,
that
yes,
and then it costs you a fortune. God forbid you got to go to the doctor.
yeah.
That's because again, the goals of the insurance companies are large premiums, large deductibles, never get the deductible done, and we never pay a dime. And we're just
Mm.
give make because again, if you do the math on health insurance companies, they are making money. And I mean money
Oh,
that we
yeah,
can't even count, billions and
of
billions of
course.
dollars.
Of course.
You
And like,
know,
shame on them. Same with the pharmaceutical companies. Shame on you. You're in it for money. You're not in it for the people. And that what I always find is so short-sighted because if people are a healthy nation, they're more productive,
and of course.
right? They feel more secure. They know they've got the backup if anything is happening. They can catch things in time before they go bad, and it puts people at ease and they work better. So I find it so short-sighted of crippling people and their health. And now what? They have to go on welfare or they have to go on something else, or what happens to them? How many end up on the street? Right? And it's like, how is that productive? How is that supporting your nation? Because the more people that are supportive, the more loyal they are and the more they step up to be creative.
And I say, without your health, what matters? What
Exactly.
matters? What
Yes.
matters? You people should always be able to afford to stay
Yeah.
healthy.
And we're looking at everything being out of whack. And of course, I think, the whole thing is this, it's like confetti right now. Everything is up there and we're looking at it and everything is chaos and everything is just maddening. But I think, we the people, this is why this show is called Your Health is Your Choice, right? And, if you know that you need more exercise or you need vitamins or you need massage therapy or you need this or that, you want to be able to afford that you can do that. You're being proactive over your health. But if you've got a health insurance that there is to support you as well, and knowing that in case I need a doctor, I know it's not going to kill me to get one, right?
Mhm.
I had no doctor for 7 years. And it was really difficult because I'm actually on certain medication that I need to be on all the time. Trying to get a tele one, trying to, having to go to emergency for prescriptions, which shouldn't be because that puts too much strain on them.
Mhm.
Fortunately, our medical situation is easing out a little bit, but, we have to look at this whole system and stop it being profit at the expense of. It's
Correct.
immoral. It's immoral.
And no, and again, it's this company is because again, your Canadian system, there's people that come down here for medicine just
Hmm.
because they can get in quicker, right? It's a
Right.
time thing.
Yes, yes, we do
And
have that problem here of
and if
delays.
there's people from your country that work here in the States and pay
Yeah,
American taxes,
yes.
right? Those people can actually get this coverage.
Hmm. Hmm.
Okay, so if they want to double dip and come to
Yeah,
the States for some things and go to Canada for others, as long as they're paying taxes here, they can actually get this coverage. So there's people from Canada that do come here
right. Well,
specifically
when we
for
need the help, we need the help. And as I said, we have a shortage here. And it's slowly coming back up, but it's still got a long ways to go. Um, and they're revamping our whole system here. But when it comes to bureaucracy, it takes time
too much
and
time.
too much time. I kind of really would like to have the mama approach. Roll up your sleeves and this needs to be done. Let's get it done. And instead of, well, we got to do research on this, or it's got to kind of reminds me of the movie Brazil. You need a requisite for a requisite for a requisite, and it's just like I feel that's where we've gone. And instead of addressing the problem that's in front of you, concentrating on what needs to be done and getting on and doing it. So,
Right. Well,
which
and the
is,
shortage of doctors, part of the shortage of doctors is
mhm.
insurance companies telling them how to
Yes,
doctor their people.
exactly.
Okay, doctors are tired of that. I mean, and if
Yes.
I was a doctor, and obviously, good doctors, their patients are family.
Hmm.
They take it personal when they're
Yes.
sick, and they take it personal if they can't help them. Well, when your hands are tied because of the insurance company, no wonder they're running
Yeah.
away in droves.
Yes.
Now, when they see, wow, okay, we can get paid for our services, take care of these people, and not have to worry about the bureaucracy,
Yeah.
that's going to bring a lot of more doctors back into play.
Well, and for the reason they signed up to be doctors in the first place. to take care of people's health. That's the reason why they became a doctor, not to get rich unless they've gone into private practice or plastic surgery, but to serve people. And if they feel like their hands are tied, you really need an MRA, but you can't afford one. Or you really need this, but you can't afford it. It handcuffs them in actually being able to treat their patient the way they want to.
Correct. Like I said, correct. I mean, it's so many things are wrong, and the things that are
Yeah.
wrong are so easy to analyze to prove why they're wrong.
Yeah,
Yet why aren't they being fixed? Well,
right.
because pharmaceutical companies, like you said, they make too much money. Okay.
Insurance companies make too
And
much money.
insurance, the both of
Yeah,
them make it's all about the dollars,
it is unfortunately not
and
about life. Yeah,
and when it comes to your health, I mean, like I say, I'm an entrepreneur, okay,
right,
but when it comes to your health, there's certain times where things got to be, worked on a little bit
right.
because people's health. I mean, I mean, our homeless problem. A lot of that is because of
Yes,
people's health. Or
especially
again,
mental health. We have a great deal of it here, and it's heartbreaking to see. And it's become even more so lately. A lot of that is like the whole distress that's going on in the world. People don't realize with people with mental health how much more strain it puts on them. This whole discord out there, and we need to bring about a better equilibrium. So, how does this company then, if it's a foundation, how does it make its money?
first of all, it doesn't make money. It's not for profit.
Right. But
Just
it's got to
basically.
obviously
First
generate
of
money in
all,
order to pay the
well,
doctors.
okay, well, again, your premiums go towards admin fees, and then the rest goes to doctor. And it's just incredible AI because AI is changing the world.
Right.
So AI determines like when with this plan, you actually get an account. So your money goes into the account. So when you
Mm.
pay your premiums, it just goes to the insurance company. You don't know what they do with it, right?
Right,
Right.
exactly.
Well, with this, your money goes into an account, and you get to actually see how your money's spent. You
Mm.
see $50 was taken out for admin, $100 for the Smith family that AI took out, thousands of people took out some money for it. You actually get to see where your money goes. So
Ah,
when
transparency. Wow, what a novelty.
it's right, and when healthcare is run efficiently like that,
Yes.
it's amazing what they can do. It's
It
just
clearly is
amazing.
people that have been in the industry that saw the flaws that wanted to start this. And, this is what I say is that we can always turn things around. If people are irate enough and to say, look, instead of just accepting the system, I want to change it around. I want to do something. And then, coming together with other people on how can we do it and then doing it, which is clearly what this organization has done. They're here to represent the people and the people's health. Bottom line. And they obviously have got very, very efficient in doing so and making sure money goes to the doctor so the doctor can support the patient so the patient can get well and be productive in their own lives.
It's not rocket science, is it?
No, it isn't. And that's the thing is like, we don't realize the answers are always in simplicity. They really are in simplicity. And, what we've seen with bureaucracy is they've made everything so convoluted that it's just a disguise, for us not to see where the money's going.
Right.
Um, right? And they don't want us to see how fat the pharmaceutical companies are going, how fat the insurance companies are going, all the back payments that are being paid. They don't want us to see that. So they tie it up in bureaucracy words that people don't understand, right?
Mhm.
Instead of simplicity, A, B, C, D. That's what we want to see. And clearly this company is doing that.
Oh yeah, no, they're coming up with new things all the time. They've just added a free dental plan.
Wow, that's huge.
They just added a free vision plan. So, because the money is coming in because they're spending it properly.
You're right.
Okay,
Efficiently.
they're doing it as right can be. Like I said, it was a too good to be true gig for me
Right.
for a while. It was.
Yeah.
I had to get the plan for myself. Okay, and the truth of the matter is, I don't even need the plan because I'm on VA here in America.
Hmm.
But I use it as a secondary. Again, I wouldn't have had that telehealth which I used. So
Yes.
there is one with the VA, but it's not open the way this
Yeah.
is 24/7. And
Hmm.
so again, using this has just been a godsend. It's like anything you can think about that people are looking for in a health company, we offer. You can, I mean, again, incentivizing people for being healthy. What health insurance company does that?
Exactly.
Right?
No, not if they're
What's
backed by pharmaceutical. They make money out of you being sick and keeping you sick.
what company says the day you're covered, now you're covered, let's check you out.
Right.
Okay?
Yes, get a baseline of where you're at.
Because pre-existing conditions, that's the killer.
Mm-hmm.
Okay? Whether it's mental health or any sort of condition, if you're not covered when that's discovered, you're on state care. Well, there's absolutely no other choice because no one
Right.
can afford that.
And
Okay?
we know how that care is.
But here's how cool this plan is. Even if you have a pre-existing condition, you can still get this. Just
Hmm.
that pre-existing issue obviously isn't covered. And I have one guy who's a restaurant owner. He's personally saving $1,600 a month, okay, on his health care.
Hmm.
But he has a pre-existing condition. He has a growth that has to be cut out every year. And that costs about $1,500. So he's just paying cash for that one issue because that's less than 1 month of his savings. And we still get that price lower too, because even when you pay cash, we can get that renegotiated. Okay.
Right.
So he's paying less than 1 month savings for his issue that he knows isn't covered.
So somebody has, like I'm asthmatic, so I wouldn't be covered for the asthma or
Right.
anything related to the asthma
Right.
because I'd still love to see that covered. I'd still love them to go one step
Sure.
further, right?
Sure.
Because for especially for me, like when I was looking at trying to find a doctor to get my new prescriptions done, right? It was always very difficult. Couldn't get them done without a prescription, couldn't find a doctor to give a prescription.
Yeah.
So, the thing is when people do have pre-existing, it's we need the help around it. But and then it's always we kind of almost feel guilty for having it because we know how much it costs to keep us alive.
Yeah.
So,
Well, but one thing, there are some pre-existing conditions that are covered. If someone has high cholesterol or high blood pressure and they're treating it, God forbid they have a future vascular event, it's covered.
hmm,
Okay.
okay.
So no, obviously you can't just take everyone with pre-existing conditions and cover it. Everyone, you'll go broke. I mean that's the only imperfection, and that's really something that's impossible to do. You
Never
know,
say impossible. There's always a
well,
possibility when people have innovative minds,
right, right. No, I got you, but financially it would be very, very difficult.
Yeah, it
But
just means
that's
they
the
have to
only
come up
issue.
with a different system.
That's true. That's true.
Again, simplify it. All right. People with pre-existing maybe pay a little bit more because around that problem, not
Well,
affecting the rest. So,
that's the reason why, one of the reasons why health insurance companies are so expensive,
hmm,
because a small portion of us are paying for, or a large portion of us are paying for the small portion that are really injured.
right.
So that's the issue. So, but there's many more issues, like I said, greed, corporate
Yes.
greed,
Oh, which we're
again,
seeing a pandemic of in itself right now. Yeah, it's
and
it's unbelievable.
it's only getting worse. That's the
And
thing.
things generally have to go worse and push the envelope until people go, enough is enough. And that's where this company, the company you're with, it's proven, it's already solidified, it's rooted, right? It's got a good foundation. And when people recognize that and go, okay, why are we all not doing this? It's simple, right? It supports the doctors and the doctors support the patient because they're not waiting for the money and everything is affordable and we can afford to do this. And I think that people go looking for alternative when they've been pushed to the limit. And the reason for doing this show is to show people there are alternative. There is an easier way. And, that generally comes about from people seeing what the problem is and deciding to be the solution, which clearly this company has been. So nobody should have to die because they can't afford medical health. Nobody should have to go bankrupt or have to sell the home or mortgage their child. Nobody should have to do that. And we need to make sure that people's health is front of everything because they can't be creative, they can't be productive, they cannot live a good life if health is hanging over them all the time.
You couldn't be more correct.
So, what's the name of the company? How do people join it? What's the process to become a patient with them?
Give me a call. and I'll do some quotes for you, and I'll set you up whether you're a single, whether you have a business, because there's different plans. So everyone gets personal conversation with me.
Hmm.
They can always call me directly with my number, which I mean you'll have posted there. I'll go through whether they're a single, whether they're a business, whether they're a big family. That's the other thing that we do. They get personal care.
Hmm.
So have them call me, have them set up a link on the Zoom call as you see with the calendar that you have.
Hmm.
And I'd love to talk to anyone who has any questions. This is even good for people on Medicare because here we have the supplemental. And right now they're fooling people into thinking you have to sign up by, I think today's the day, when with this plan, any month you sign up, your coverage starts the first of next month. So, like I said, people can call me, text me. I'm an open book.
And if people want to kind of look at the company before they call you, do their own research on it, do you have your own particular tag with them?
Well, sure. I mean, the name of the company, I mean, I'll tell you again, I'm a rep for them. So
Right.
the name of the company is Impact.
Impacts.
Mm-hmm.
And so if you've got a link that will go to
Sure.
your link with them so they can research, and if they like what they're seeing, then they can reach out to you from
Well,
there
what
as
I
well.
tell people is I can send you stuff all day long, right?
Hmm.
And it's just like when someone asks for a referral, who am I going to send you someone who hates me? Right?
Yes.
Okay. So I tell people, I'll send you whatever you need, but do your own research. I
Hmm.
everyone who does their own research immediately calls me back.
Right.
Now they found out on their own. I didn't send them some pretty thing or this or
Hmm.
that. They did their own research. They see that this is for real. This
Hmm.
is the revolution of health insurance
Right.
because our health
Yes.
insurance industry is broken. And
Oh,
it's
it's
like I said,
shattered.
and again, this is about life. This is about
Yeah.
living.
Yeah.
When I can make a living helping people,
Mm.
it's the great. It's the greatest job on earth.
Exactly. And the thing is that there is so much else to navigate through our lives, right? Jobs are being threatened. You've got kids' education. There's so much out there. The last thing they need is to be worrying about health as well. Johnny breaks his leg. What do you do? Put a couple of sticks on it and reset it yourself because you can't afford to go to the hospital. It's like knowing that I'm covered. We can concentrate on Johnny getting better. His leg has been set properly, and now we can get back on with life. Peace of mind.
Well, it's more than that. I mean, what are the majority of the fights that couples get in? It's over
Mm.
finance.
Yes. Oh, yes.
And so when now you're saying, well, I don't want to pay that $1,800 a month insurance bill for this crappy insurance we got. Now it's again, it's life changing for more than health. I'm about living.
Yes.
I know you are too. If you're not enjoying this journey, what's the sense?
And
And
you
we,
can't enjoy this journey if your health is an issue, if you can't afford your health. There's so many things that go wrong with that. It affects mentally, it affects physically. Obviously, it affects your bank account. Then you start feeling guilty because, you feel a burden on people because you can't afford to go and get the right care. Nobody should be in that position. They should be able to get the care they need and custom care, not a band-aid care. Care that we have a doctor who has the time because they know they're going to get paid to give the patient the time to investigate what the problem is so that they can really help them get well. And if a doctor doesn't have that kind of time because I don't know if I'm going to get paid next, we need to support the doctors so they can support the patients.
well, and another thing is like business owners,
Mhm.
they obviously love to offer health care if they can afford it.
Yes.
And there's two answers I get from it from business owners is, yes, I'm offering health insurance, but it's freaking killing me.
Yeah.
Or second, I would love to offer it, I just can't afford it.
Yeah.
And businesses lose their good people because people
Hmm.
get jobs just because they're offering health insurance.
Exactly.
Okay.
Exactly.
And what I can do is I have other hybrid plans with other insurance companies that I can take care of businesses of any size,
Mm.
save them a ton of money. And again, it's not just about saving the money. The plan is superior
Hmm.
because half your money or more doesn't go to bureaucracy.
All right. Making somebody else fat. Exactly. More than half of the money goes to making them fat.
Well, when you see something on TV,
Mm.
where do you think that money comes from?
Exactly. But what I laugh about those things is like, oh, depression hurts. And they show all these people suffering through depression. And you can take this drug and be happy. And the next 10 minutes is how it's going to kill you, you know? And it's like, would anybody really want to
Right.
take that drug? Yeah.
No, and drugs again. That was when I'm talking about my personal journey. I almost didn't call the telehealth because I knew I had an issue. I thought it was muscular, and I said no to the wife. I'm not going to call him because I didn't want pills. I
Right.
didn't want muscle relaxers. I didn't want pain pills. And for what I thought it was, I was
Hmm.
sure that's what he was going to do.
Yeah.
So I wasn't going to call. Thank God I
Mm.
did because I didn't have the fear of calling.
Yeah.
People have the fear of checking
Yes.
out their issues. Or I'm still a man, so we're a little different. We have that pride factor, right?
Yes.
I was brought up.
Oh, I'm fine. The arm is dropping off, but I'm fine.
Well, I was brought up in the era just rub dirt on it. You'll be fine.
Yeah,
Right?
yeah,
You
exactly.
got
10-mile walk will resolve
you
it.
can't do that anymore. But
No.
male pride is
Mm-mm.
huge. And
Yeah,
people die because they got a chest pain and they won't check it out because they're afraid.
exactly. Oh, just
People have to.
indigestion. Yes.
And my thing is, hey, you know what? I hope you think you're a wuss, and I hope it was wrong, right? I
Mm,
hope nothing was wrong, right? Okay, I mean that's the best scenario, right?
mm,
But check yourself out for God's sake. Check yourself out. Stay proactive with your health. It's
yes.
not just how long you live; it's quality of life.
Oh, 100%.
Because
Yes.
it's just everything revolves around your health. And like you talked about earlier, you're more productive if you're healthy.
Hmm.
Obviously you're more productive. You're not taking sick days. You're not angry at the wife because you're not feeling good. You're not getting into arguments over money. I mean, this goes a lot more than just, hey, this is quality healthcare.
Yeah.
It's
But it's
it's like,
also if you have children, children get sick.
well,
It's like, can I afford to call the doctor? Or I can call the doctor and I can find out what's wrong with my child and I can get my child the help that it needs right
well,
now. And what peace of mind in that? Because nobody wants to see your child sick.
again, man, I talk about that all the time. It's like a kid's got a flu or something. Well, you're not going to throw them in a station wagon or the SUV nowadays
Yeah.
and drive all the kids down to the doctor, right? You're just not. You're just going to deal with it. You're going to go get some
Right.
Advil. You're going to get some
Mm,
over-the-counter stuff, maybe. Now you can keep the kids healthy. You know.
yeah.
And I talk about my wife. She had an ugly bronchial cough. And rather than make an appointment for a doctor, wait to go to the doctor, get the prescription, we called the telehealth. I went and picked it up. 48 hours later, she's good to go.
Well,
You
the
know,
other thing is, do you really want to be sick and spewing and coughing and blurring amongst other people who are sick? They may not have the flu, they may have something else, and you coughing or spluttering in the waiting room, it's just everybody's like this. So,
people get
it's
sick in hospitals all the time.
yeah,
And I
yeah, they
hate to
get
say
sick
that,
going there.
but my mom passed away from MRSA that she got, at a rehab facility. So,
Ah, yeah,
so yeah, I am well versed on. You go to the doctor to get sick.
yeah,
You know,
exactly. Yeah,
it's
and
crazy.
like telemedicine is so good these days. Done through like a Zoom, they can really, really look at you. No, they can't check your pulse, but they can have you proactive with them. Can you just do this? Can you just do that? So they can see that. But they can tell by the symptoms. Okay, now this is a warning. Okay, that's okay. We can perhaps try this or that. And the stitching time saves nine. We want people to be able to go when something is beginning to get bad so that they're not ending up really very, very bad because they've ignored it or they can't afford it. So yeah, and that's part of your health is your choice is we can all be proactive. Our diet, our state of mind, the nutritionals that we're getting in there, um, exercise, whatever you do, we can always be proactive. But there's always going to be a point when we're going to need a doctor or we have an accident or we need emergency. And you don't need to have that worry and concern of I can't afford it. So with a plan like this, people can afford it. And it's like somebody gets sick, that's the one thing you're not worrying about is being able to afford it. You know that the help is there. You can concentrate on whoever's sick and getting them well. And the burden hasn't then been put on the family financially of like, oh my God, we can't afford pay the rent this month because it went on the bill. So a lot of peace of mind there.
And it's all about living life.
Yeah,
It's all
exactly.
about living life.
So, I'm glad that you were skeptical, but then you joined up and then it proved it to you that it works. I said we have got to a stage in life when we look at something and go, no, this must be a con. It's too good to be true. And it's unfortunate that we've got there. But because there's been so many cons, we do have to have a due diligence. And as you said, you're completely open. The company's completely open on how they work. And I suggest you have a look for yourself. Have a look for yourself and then reach out to Larry and go, I've had a look. All right. I'd like to know what's going to cost my family. What's it going to cost me? Where does it cover and all of that? And then, get on the plan so that you can give yourself some peace of mind. I want people to go into 2026 without worrying about health issues, right? I'm going to be proactive over my health, but I know that there's support there. Should I need it, that's not going to cost me an arm and a leg. What's going on in the States, the pharmaceutical companies and the insurance companies, they're not going to change anytime soon. Hopefully down the road, we'll see a change in them, some accountability, some system change, but it's not going to happen anytime soon. You need a company where it's not for profit. It's an investment in humanity, right?
Correct.
An investment in humanity means humanity is strong, equilibriumed, creative, productive, and we should invest in health because that's, as you've said before, there is nothing else. I don't care how important you are, how rich you are, or anything else. If you don't have health, you're poor. Financially and physically. So we need to look at that. And how can we afford it and have the peace of mind, especially if you have a family? Because there's nothing worse than having to go to hospital with your child and you're dealing with the crisis that is in front of you and then get handed a bill that you're going to have to sell your house to cover. Uh-uh. Isn't resolving any issue whatsoever. So let's go through the links again. Quickly. So we've got people can find you at LinkedIn if they want to reach out to you there. Larry Goldstein, Goldstein, Creating Life, agency.com. They can find you there. They can also find you on Impact Health Sharing, Affordable Healthcare, but also they can reach out to you and book an appointment to speak to you, which will be on his show page, folks. So don't forget, if you're listening to this, you go to selfdiscoverywisdom.com and put in Larry Goldstein, and you will see all those links and the link to go to him directly. If you want to do the research on it, on Impact Health Sharing, have a look at it. See for yourself. Maybe you've listened to the show and go, it's too good to be true. Listen to it and see and do your own investigation and then reach out to Larry and he'll help you customize what's good for you and your family and have that peace of mind, that I know I am supported in my health and it's not something that I'm going to have to sacrifice something for in order to maintain. So that's very important. So thanks very much for being with me today, Larry.
Oh, my pleasure. They can always contact me directly on the cell phone.
All
I'll
right.
pick up the phone. It's 602-989-4200. Call or text me. Again, I'll gladly talk to you. I'll explain everything. I'll show you in detail, and we'll talk about yourself, your family, your business, and we'll come up with something that I promise is going to not only save you money, but give you better care.
And perhaps save your life. You never know,
You
right?
never know. Save mine.
Right, exactly. And we just want to have some peace of mind so we can get on enjoying life and really, contributing to life without the burden of worrying whether you can afford your own health, which is really important. So don't forget to share this show out with people, folks. Don't forget to talk to people. If you know somebody going through a medical issue, they're getting screwed over, give them this show. Let them listen to it for themselves and let them investigate for themselves. This isn't something you keep to yourself. This is something you share far and wide with your organizations, with your communities, with your groups, with other family members. People are paying through the nose and not getting covered. So let's give them an alternative. So thanks so much, Larry. And to everyone else out there, I wish you well. Bye for now.
Thank you.
We hope that you enjoyed the show. There are so many more for you here on selfdiscoverywisdom.com. Just go to the podcast tag at the top there and you will see all the many genres and all 3,000 shows ready for your listening. We are here to serve you, to help you on your journey of life, and we know that through inspiration it begets invitation. We are supported by you, the listeners, and those that we interview. Anything that you can spare us in donation would be greatly accepted, and we do hope that you enjoy the next show.